Hey team, so today I wanted to touch on hip pain because I have a lot of different questions related to the hip and how do you know it's not back pain or sciatica causing your symptoms? How do you know it's arthritis versus a labral tear? How do you know it's not bursitis, or what is bursitis versus iliotibial band syndrome, something like that. So just a quick little note here. I'm going to share my screen. I'm going to show you that this is what the hip joint looks like overall. And you're going to see this little piece of cartilage that sticks out, and it actually surrounds all the way around the joint itself. And that's the labrum. That helps to make the joint really congruent or move very well, keeps it in place. And you're going to see here, this is the joint surface. So keep those two in mind. Another little area I want you to see is this picture, which these are the deep muscles of the hip itself. So you're going to see these muscles here. And this is the one that we talk about quite a bit, called the piriformis, being Piriformis Syndrome. And this will have the sciatic nerve come out of here and drop right down below underneath this muscle, and then it will run down the leg. So if you're getting an entrapment or pinching to that sciatic nerve from that muscle, well, this can be the culprit. Third picture is the outside muscles of the hip. So these are on the outside. This is the big gluteus maximus, the butt muscle you see, but I really wanted you to see this iliotibial band. And this is a really thick tendon that wraps all the way from the knee all the way up and connects to this little muscle called the tensor fascia lata. So you can see that there's a lot of different structures that are in play, but I'll give you a couple hints. If you have pain that's deep into the joint, so deep into the groin itself, so it can refer into the groin muscles over here, that's usually internal to the hip itself. So you're going to be having either labral issues or arthritis issues. And based on the limited mobility you have, usually age will give it away as well, that will dictate if that's labrum versus arthritis itself. If you get a lot of clicking and popping in here and you're a younger individual, the labrum most likely is torn, and it's going to refer that pain into the groin as well. So that's your first hint. Number two, if you're getting pain that's traveling from the butt down the leg, it can be Piriformis syndrome, or it can be sciatica coming from the back. But if you're getting a lot of tenderness right on this butt muscles, and you can run your hand from the hip bone all the way over to the sacrum over here, and it's super tender there, and it causes some of that shooting pain, yep, it's probably going to be Piriformis syndrome from the hip. If you're getting pain right on the outside of the hip bone, right over here on the side, that's usually related to some type of leg length discrepancy. So when we're talking about the hip itself, that's most likely going to be a leg length discrepancy. So what I mean is that the pelvis is not set neutral, and that you have one leg that's just a little bit longer than the other, and it's going to offset the pelvis. And every time you take a step and every time you move, it's going to put pressure onto that outside of the hip. So then you're going to get what's considered a bursitis or iliotibial band syndrome, ITB syndrome. So the key is really identifying where your symptoms are coming from, and then isolating that area and testing it to see if, yes, that's arthritis, labrum, Piriformis syndrome, bursitis, iliotibial band syndrome. So overall, there is a way to differentiate the multiple hip pathologies, but the key is getting the right information to get the right diagnosis, which allows then a turkey like me to provide the right intervention. So hopefully this video is helpful for you, and it gives you good information moving forward on, is it sciatica? Is it hip pain? Is it arthritis? What do you do? So thanks for watching today, team. See you next time.